Thank you. I'm Tim Carpenter, Progressive Democrats of America, and I'm very honored to be on the panel and with all of you as part of this social movement to bring about guaranteed health care for all. I don't think there's any argument here on why we're here. I want to just take my 6.5 minutes to talk more about tactics and what we can do collectively together this weekend, because we're going to be together for a long time. Progressive Democrats of America was founded in 2004, the last day when the Democrats met, because we were frustrated as Democrats that Dennis Kucinich never really got the debate that we deserved at the National Convention. When we met there, a majority of the delegates, people forget, but 72% of the delegates that were in Boston that day were opposed to the occupation. Dennis had led the vote in Congress, 122 members to vote against that, and we were never able to get that vote. We were at the convention as part of a delegation working not only with Congressman Kucinich, but also with Congressman Conyers in support of single-payer health care. While Dennis Kucinich didn't win the nomination, what he did put in place and put in motion a movement that today, 4 years later, all of those issues are very relevant today. Our strategy then is the same strategy today. And as I look down the panel, in the last year, I'm honored that PDA can be part of the electoral arm. While for some of us it may be the Green Party, others it may be the Socialist Party, others it may be independents. I honestly didn't hear any Republicans here yet, but whatever the electoral strategy is, we need to do it. At a conference like this, we need to come together. There is a smorgasbord of opportunity for us, whether at the national level or the state level. There's all kinds of work to do. Not everybody can get arrested, but some of us can get arrested. Not all of us can run for Congress, but all of us can challenge members of Congress. So what PDA was founded in the belief that we could organize at the grassroots level. This is what I want to leave this weekend with, to talk about tactics and models. As Terry said, now has just launched what hopefully will be a national movement here to repeal the Hyde Amendment, not just what's going to happen in the next couple of weeks with the amendment in regards to the health care, but now it's going to be out in the streets. It's our responsibility as part of a larger social movement, as single-payer activists, as you all clap, to be there with now, just as we're asking now to be with us. It's our responsibility as activists to stand with the workers, just as they're asking us to stand with them, to stand to challenge the electoral process inside and outside the party. And what I mean by inside and outside the party, for others it's outside, others it's too much inside. But what we believe in PDA is an inside-outside strategy. You just heard one of the most eloquent spokespersons I've heard in some time to talk about the urgency to bring the passing of the social movements inside the electoral arena. You heard what Terry just said, the need to challenge these elected officials. Like all of you here, we are very disappointed in the vote that happened. We believe as a movement and as part of that electoral movement, we need to thank our friends, and there are two of them today. The glass is a little bit full today as we meet. Eric Massa and Dennis Kucinich did the right thing. Instrument is on. As PDA, we believe we need to lead this conference and continue the work of looking for the next Eric Massas, to find the next Dennis Kucinichs, to challenge those, as Terry just said, in the upcoming primaries. My 5 minutes, what am I down to? 4 minutes? What I would like to argue this weekend collectively, that we take the work that we've done as a Guaranteed Health, the groups that are part of the Guaranteed Health Conference, Leadership Conference, the four of us, CNA, PNHP, Healthcare Now, and PDA, we've done a great job at the national level, I believe. I think we've done a great job, and what we need to do is bring that energy down into the grassroots. And we need to do the work of PNHP at the grassroots level, better integrated. But as the electoral arm, what we would like to offer today, for those of you who are ready to work in the electoral arena, to stand with now, to challenge these candidates, and not just challenge them on street heat, but it's time now that the people in this room, just as we challenged the PNHP doctors a month ago, these are the folks that need to run for political office in this room. We can't look outside of this room to find the single-payer activists. They're here in this room. We need to make sure that the next round of candidates are strongly single-payer supported. We need to challenge those who have stood in our way. PDA is organized at the congressional level. What we would like to offer today as we leap forward is to find those groups in your neighborhood, in your communities. Look around this room. Where is the Now chapter? Where is the PNHP chapter? Where is the Healthcare Now chapter? Where is the PDA chapter? You heard from Santa Monica to Missouri to Massachusetts to Illinois, the PDA chapters. We need to link up together. Whatever we're doing, we're not doing it correctly yet. We got a lot of work to do. We got to stop talking to ourselves. We got to link up, and we got to take this work to the congressional levels. What I mean by the congressional levels, those of you that are willing to get arrested, you need to go to the congressional offices and get arrested. Those of you who have the stomach, They call it sausage making, but now we have to say the tofu making of legislation. But those of you who have that stomach, you have to go to the legislators, not just to protest them on the outside. You need to join with those activists who are beginning, just as Terry's challenged us in regards to the repeal of the Hyde Amendment. PDA will be part of a coalition that's going to go to every single congressional member's office that we can organize. We're going to start with 10 next week, we're going to build to 20 in December, and then in January we're going to build to 40. And we're going to go to every member of Congress on the third Wednesday of every month, stop talking to ourselves, talk to our neighbors and friends, take a roll of healthcare not warfare stickers, get on the website of the National Priorities Project, break down the economic cost of what we haven't even mentioned Iraq and Afghanistan yet, but what is that costing us in real terms? Where can we redirect that money? Where is the money for single-payer health care? It's in the military budget. So our challenge to you is this conference, find those activists in your area that are willing to go to the congressional member's office, not only to get arrested, but to meet with your member of Congress, and meet with them every time they come back, and every time they have a town hall meeting, and every time they have a $1,000 fundraiser, and a $100,000 fundraiser, and every time Speaker Pelosi comes in to do fundraising for them, to challenge them on the fundamental question of health care, not warfare. It's that simple. So as PDA, we're here to work with you to build the larger social movement, because every great social movement begins in the streets, but ends in the halls of Congress. We want to build the legislatures that are going to do it. Not just Democrats, but progressives. We want a progressive majority. Thank you.